Hello. Today, I'd like to speak a little bit about whippets. I'll begin by giving a brief description of whippets, then talk about exactly how they work. Finally, I'll discuss some of the current laws regarding whippet use, its prevalence among society, the dangers whippet use can present. So, what exactly are whippets? Whippets are small, pressurized containers of nitrous oxide, aka laughing gas, which are normally used in food processing. This nitrous oxide is filled into balloons and inhaled, creating a euphoric, short-lasting, and intoxicating high, which has been described as similar to alcohol. Whippets are very popular among nightclub goers, especially in the United Kingdom, but more on this later. Now, I'd like to talk about some of the mechanisms of nitrous oxide, how it utilizes these to produce its effects on the body. While it has been proven to affect many channel types, producing a multitude of effects, I will speak on three primary ones. First, its anesthetic/euphoric effects, then its analgesic effects, and finally, its anxiolytic effects. So let's begin with the anesthetic properties of nitrous oxide. Nitrous oxide, like PCP or ketamine, works as an NMDA antagonist. While its exact molecular mechanism has not yet been determined, an influential study has demonstrated the necessity of these receptors to produce nitrous oxide's anesthetic behavioral effects. So let's begin by looking at the figure in the middle. This experiment observed anesthetic behavior in nematodes. Here, we see the amount of time spent moving backwards as well as changes in directions, which are movements described as normal under non-anesthetic conditions, was markedly decreased by nitrous oxide introduction in a dose-dependent manner. Now let's move to the final figure. What we see here is when the gene NMR1, which encoded the NMDA receptor in the nematode, was mutated, there was not a significant difference in reversals per minute when nitrous oxide was introduced versus oxygen. However, when the gene was rescued, we again see a significant decrease in reversal per minute upon nitrous oxide introduction, implicating the importance of nitrous oxide action at NMDA receptors in anesthetic behavior. If we look at some of the circuitry involved with NMDA antagonism, we can see that when nitrous oxide antagonizes glutamatergic NMDA signaling, it leads to inhibition of GABAergic neurons. These GABAergic neurons are preventing acetylcholine release in a variety of areas, such as the basal ganglia, the hippocampus, and several cortices. When the NMDA receptors on these GABAergic neurons are blocked, the acetylcholine signaling is disinhibited. This disinhibition is most likely how nitrous oxide produces its euphoric, anesthetic, and sometimes even hallucinogenic effects, very much in a similar manner to PCP or ketamine. Let's now move to the analgesic properties of nitrous oxide. The current hypothesis is that nitrous oxide induces endogenous opioid peptide release onto kappa opioid receptors. If we look at the figure in the left corner, we can examine a study in which abdominal constriction test was performed to examine the anti-nociception of nitrous oxide. In this study, percent anti-nociception was calculated as control constrictions minus treatment constrictions divided by the control. Here, the black bars are the control, while the striped bars represent anti-nociception with a non-selective opioid receptor antagonist applied. What we see is a significant decrease of anti-nociception if this non-selective antagonist is applied. However, when U50488H, which is a kappa receptor ligand, is given with the antagonist, we see analgesia effects like the control. Although, if the non-selective antagonist is applied with CTOP, which is a mu receptor ligand, then the analgesic properties of nitrous oxide are not as great, implicating the kappa rather than the mu receptor is important here. Supporting the opioid hypothesis is the fact that subjects made tolerant to morphine were also class tolerant to nitrous oxide, which is shown in the left figure. However, the figure on the right demonstrates that nitrous oxide tolerant subjects were not tolerant to morphine, suggesting they induce opioid peptide release rather than act at the receptors themselves. We see the proposed mechanism in which nitrous oxide induces peptide release. While again, the precise method is unclear, it seems that nitrous oxide induces the activation of nitric oxide synthase. This enzyme will convert L-arginine to nitric oxide and L-citrulline. This then will induce peptide release. Supraspinally, it seems that dynorphins are the endogenous peptides released by nitrous oxide. Spinally, both dynorphins and methionine enkephalins have been implicated. This was proven when anti-sera injections against these were tested and found that only anti-sera against dynorphins blocked analgesia supraspinally, while anti-sera injections against both blocked them spinally. Additionally, nitric oxide seems to mediate this endogenous peptide release, as studies in which nitric oxide synthase activity was inhibited blocked the anti-nociception effects of nitrous oxide. Nitrous oxide has the ability to block pain in two areas, as we've just seen. This is a result of the method in which nitrous oxide exerts analgesic effects on two aspects of the descending pain pathways. Initially, in both paths, nitrous oxide acts in the para-aqueductal gray, will cause endogenous opioid release onto neurons located in the pons. Normally, these neurons release GABA onto adrenergic neurons, inhibiting their action. Some of the adrenergic neurons are directly located on second-order neurons in the descending pain pathway, while others are on GABA interneurons located in the spinal cord. When they are disinhibited by the peptides, these adrenergic neurons can cause anti-nociception by both directly releasing norepinephrine onto the second-order neurons and onto the GABA interneurons, which will block painful stimuli. Finally, let's learn about the anxiolytic properties of nitrous oxide use. Looking at the two figures below, it is apparent that in the classic light-dark exploration test of anxiety, mice had similar behavioral responses to nitrous oxide as they did to a benzodiazepine. In both cases, they spent more time in the light compartments, which indicates decreased anxiety when given either nitrous oxide or clorazepam. Furthermore, as shown in the figure on the right, benzodiazepine site antagonists decrease these anxiolytic effects in nitrous oxide, much like they would in benzos. Additionally, evidence in other studies have shown that mice made cross-tolerant to benzos were additionally cross-tolerant to nitrous oxide, suggesting that nitrous oxide modulates GABA receptors in a highly analogous manner to benzodiazepines. The proposed anxiolytic mechanism involves the influx of chloride potentially activating calmodulin, which will lead to the activation of nitric oxide synthase. This synthase will again convert L-arginine to L-citrulline and nitric oxide. Eventually, this will stimulate production of cyclic GMP, whose activation of protein kinase G leads to decreased anxiety, although exactly how this occurs is still unclear. Now that we've seen how whippets work, let's examine how popular they are and what their current legal status is. Nitrous oxide is not a scheduled substance under U.S. federal law and is easily purchasable for supposed use in food production. One study of Missouri adolescents who were receiving treatment in statewide facilities demonstrated that around 16% of them had reported using whippets recreationally. It is interesting to note that of this 16%, 90% have reported also using other volatile solvents, perhaps indicating that those using whippets are more likely to try other dangerous inhalants. In the United Kingdom, whippets are extremely popular. There, they are reported to be the fourth most popular drug, with 7.6% of people aged 16 to 24 reporting having used them within the last year in a 2013 to 2014 study. Up until 2016, no laws on a national scale in the UK existed to prevent whippet use. And while the Psychoactive Substances Act does prevent sale and use of nitrous oxide as an inhalant, it remains legal to own and easy to sell under false pretenses. I'd like to finish my presentation by speaking about some of the dangers whippet abuse can cause. Now, some view whippets as relatively safe, perhaps because of its legality or short-lasting effects. However, like other inhalants, whippets run the risk of sudden sniffing death syndrome. Furthermore, the decreased motor coordination can be a source of potential physical injury. It is also worth noting that because whippets have a relatively short high, individuals will inhale them many times, which can lead to habit forming and addiction. In a number of recent case studies, patients who had abused whippets sometimes show acute demyelinating neuropathy or limb numbness resulting from the oxidizing effect nitrous oxide has on the cobalt ions in vitamin B12. This will prevent vitamin B12's ability to recycle homocysteine to methionine, which is important for the methylation of myelin proteins. Disruption of vitamin B12 function can also lead to polyneuropathy or some neuropsychiatric problems. One famous example of whippet danger was when the actress Demi Moore was hospitalized for seizure-like symptoms due to excessive nitrous oxide abuse.